The evaluation process for lung transplants involves many elements and processes. The goals of the evaluation process are to determine if a potential candidate needs a lung transplant, to determine if a potential candidate will have a good outcome, to determine if a potential candidate will take good care of themselves and their new lungs after transplant. Transplant process. There are 4 stages to the transplant process: evaluation, waiting list, transplant surgery, post-transplant care. Each phase is assigned a team of transplant specialists who will be responsible for coordinating your care. You will meet many of these team members during your evaluation. An evaluation for lung transplant involves many tests, procedures, and visits with other doctors. It also includes meeting with many members of the transplant team. All of these consultations, tests, and procedures will help us know if a lung transplant is the right treatment or if it is a poor choice for you. The test will also help us know if there's any other treatment besides a lung transplant that can help you. We will inform you of your test results, including new medical information you may not have known before, which could cause emotional stress. If accepted for lung transplantation, you will be placed on the computerized national priority list following final approval by your insurance provider based on your allocation score, your size and blood type, your geographic location. Your physician continually reassesses your appropriateness for transplant surgery during each clinic visit or while in the hospital, as long as you are on the waiting list. There are tests that must be done to help us make the final decision about whether you need and/or qualify for lung transplant. Blood and other tests will give us more information about you and your illness. For example, we will do tests to see how well your kidneys and liver function. Other tests may be required based on the results of your routine testing. You will meet with members of our transplant team. Cardiac testing, echocardiogram, electrocardiogram or EKG, angiogram or cardiac CT, right heart pressure testing. Imaging studies, carotid scan, CT scan of the chest, VQ scan, also known as a ventilation perfusion scan, pulmonary function test, blood gas, and 6-minute walk study. Dental checkup to check for infected teeth or gums. Other tests as determined by your medical history. Age-specific cancer screening, colonoscopy as indicated. For men, prostate antigen test or PSA. For women, pap smear, mammogram as indicated. Neurocognitive testing or frailty testing may be requested for some candidates to assess your ability to care for yourself and rehabilitate following transplant surgery. Blood testing to check your heart, kidney, and liver function. Blood tests will be performed to check you for diseases such as HIV, hepatitis, tuberculosis, and others. Blood tests to see if you have thyroid problems or diabetes. Urine or blood testing to check for smoking, alcohol, and illicit drug use. Blood to check your antibodies for organ matching. 2 blood types will be checked to make sure you receive the correct organ donor. Standard consultations. You will meet with all or some of the following team members: transplant pulmonologist, transplant surgeon, transplant social worker, transplant cardiologist, transplant coordinator, transplant psychiatrist, transplant pharmacist, transplant dietitian, other specialists as determined by your doctor and medical history.
All transplant candidates are evaluated for transplantation according to program criteria and standardized processes. Every transplant program has specific criteria that guides the team about whether you are an appropriate candidate for transplantation. general center and program-specific guidelines that help us understand that you are sick enough and fulfill the acceptable standards to receive a first-time lung transplant or a retransplant if needed. All medical and psychosocial factors revealed during your evaluation process are considered by the Multidisciplinary Selection Committee. Transplantation may not be appropriate based on current medical or psychosocial factors that may reduce your chance of survival or the overall success of the lung transplant following transplantation or retransplantation. Patients can be reconsidered by the selection committee if previous issues are improved or reversed as outlined by the committee and meet program selection criteria guidelines. You have the right to request a copy of our selection criteria. If ultimately denied by our committee, we can forward your records to other transplant programs if you wish and request their consideration on your behalf. Other centers have their own selection criteria and may require full evaluation with their program prior to making a decision. It is made up of members of the transplant team from all specialties. Your in-person team member consultations are discussed. They're held weekly on Thursday mornings or more urgently if needed. Your case will be presented after all or most of your test results are available. You'll be notified by phone or in person after your case is presented in the selection committee meeting of the outcome or if further workup is required. The outcome of the selection committee meeting could fall under one of four categories. Early, transplant is not needed at this time and you'll be followed by the medical team. Accepted, you're approved to be placed on the waiting list. Represent to committee, additional testing required to make decision, or denied, transplantation is not deemed appropriate. The selection committee will also determine what surgery you require and any other procedures or special circumstances, such as double lung versus single lung, whether cardiac procedures are also required, such as bypass or valve surgery, any pre-surgery treatment required for elevated antibodies, any testing or consultant follow-up required by the committee while you are on the waiting list. If on the waiting list for 1 year, some repeat testing will be required and your case will be rediscussed with the selection committee. Factors that may exclude you from receiving a transplant. You do not want a transplant after receiving more information about the process and requirements. This is your right and your decision. Active tobacco, drug, or alcohol use, lack of a support system or resources to be followed at UCLA following transplant. UCLA requires a primary and a secondary caregiver after transplant. UCLA requires someone to drive you to appointments for 6 weeks or longer following transplant, as you will not be allowed to drive yourself. Local housing will be required for those living a far distance from UCLA. Once you are placed on the UNOS waiting list, there are factors that result in your removal from that list, including but not limited to your medical condition improves and transplant is not needed. Your medical condition dramatically worsens and your doctors feel you are too sick to survive transplant. Your candidacy for transplant can also be denied due to documented past or current issues with compliance. Compliance refers to taking your medications as ordered, scheduling and attending your appointments, completing the required testing for maintenance on the list and following transplant, abstaining from substance abuse, and communicating with your transplant team as instructed. This is taken into account during the selection process. You and your support network are responsible for following the medical instructions of the transplant team. If you are having problems meeting the requirements for your medical care, your transplant team, physician, coordinator, social worker, and financial coordinator can connect you to the appropriate resources to assist you. Your transplanted lungs can fail due to noncompliance, and this will be viewed negatively by the team. Please do not be afraid to discuss any issues with the team that may affect your health and the success of your transplanted lungs.